for joining us today for an important live Q&A about children, teens, and mental health. Joining us today for this Q&A is Dr. Mike Vance. Thank you for joining us.
Thanks for inviting me.
Dr. Vance is a pediatric psychologist, and he's also director of children's behavioral health. And I don't know if you knew this, today is actually Mental Health Day, as designated by the World Health Organization. So the topic is certainly timely, but I know we're of the mind that this is a topic we want to be talking about and educating ourselves about year-round when it comes to children and mental health. So if you have any questions for Dr. Vance as we're talking, please don't hesitate to put those in the comments below. Or because this is a little bit more of a sensitive topic for some people, you can also DM us. You can direct message us as well. And we're going to try to handle everything as thoughtfully and sensitively as possible. And we also wanted to just share the disclaimer that this content is meant to be helpful, informative, and general information, but it's certainly not comprehensive, and it's not intended to be used to provide individual diagnosis, advice, or specific treatment recommendations. So Dr. Vance, in broad strokes, how would you describe the mental health landscape right now in the world of children and teens? What are you seeing?
Well, Sarah, we're seeing a lot of the similar issues that we saw 5 to 10 years ago. Depression is a very common theme in our offices. Anxiety is a very common theme. We're seeing eating disorders continuing to present. The ADHD, of course, is pretty prevalent. The difference probably is we're seeing more kids with these difficulties, and we're seeing the kids with more severe challenges and needs, and we're also seeing these kids at younger ages. They're presenting at younger ages.
So maybe you would have seen depression at 10 and it's 5, or what is younger?
The trend has more been like 2 to 3 years younger,
okay,
depending upon the diagnosis. And specifically, for an example, in our eating disorder program, we've seen the average age of the patients decline by about 3 years over the last 5 to 7 years. And it's good that we're catching kids earlier, because the earlier that we can establish these kids with an appropriate diagnosis and an appropriate treatment course is fantastic, because their recovery rates are quicker. We are less invasive on our efforts and time, and it impacts far less of their daily lives. We're good at what we do, but the sooner we get to do it, the better off everybody is.
Why do you think you're seeing these conditions, these disorders in younger children, though? Do you think people are more aware? What do you sense?
So I hope that's part of the awareness piece, because we are noticing that more families and children are reaching out for mental health services. And if we look at take a population base and we look at the kids that actually we can identify that have a certain diagnosis, and then we do demographics to see who's getting treatment, those numbers are increasing. So I do think we're hopefully reducing some of the stigma that is associated with seeking mental health treatment. And I think at the issue of younger ages, I think families are more aware of, through social media, through television, through other activities, of mental illness. We talk about it more often. So maybe they hear that message from teachers 2 or 3 times. But I do caution, the average kid that we see has probably struggled with what they've had for far longer. So we could even get better at catching them earlier.
It's a good thing to know. So speaking of earlier, we received the following question from a mom whose son had been affected by the suicide of a peer, and it was younger than you would think in her email, and we thank her for her message. How can parents of high school kids, but even of elementary aged children, explain suicide to their children and help them walk through that and process it?
Great question, Sarah. First of all, I would take a couple steps back, and parents have got to get comfortable talking to their kids about mental health issues. And kids then have got to get comfortable talking to their parents there. A lot of times the kids will reach out about a mental health issue, and the parent will either kind of freeze because they don't want to say the wrong thing, or they'll blah, 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 go overboard, and the kid's like, I really didn't want all that, I just wanted this one thing. So it's part of that. If your child does come to you, no matter what their age, is taking time to remove some of the distractors, Because if they're talking about mental health, it's hard for them to talk about it with you. So if they're opening that door, you need to remove distractors and sit down with them and say, if you can't do it right at that moment, then later in the day say, hey, Sarah, this morning you brought this up, and I couldn't give it my best attention then because I was driving. But I'm so proud of you for bringing that up. Let's talk about it. And I think the key there is really listening, because you don't really know what the where they're coming from on it. You got to give them time and listen to where they're coming from on it, and then you'll get a better chance to do it.
Like, do they want information? Do they want comfort? Like, what's behind the question?
Is it something that they're feeling, or something they heard a friend say? It's just like other difficult topics that children and parents have. Being a great listener and actually understanding what the child's question is. And one of the other simple techniques that I use a lot with kids is to always use the word what. You say, how do we help kids make sense out of suicide? It's kind of hard for adults to make sense out of something that maybe doesn't make sense to them. So I'm not sure we need to have somebody make sense out of it. But what we really need to do is, hey, if you're feeling this way, or one of your friends feeling this way, or even well before you start thinking about self-harm, here's what we need to do to make sure you're engaged with people, whether it's your school counselor, your school psychologist, your family physician or pediatrician, trusted adults that can be reached out. Those discussions need to happen, and we need to get comfortable with them.
Anything else that you'd like to share with a parent who, a peer has committed suicide, and any other advice for how to be there for your child, aside from listening, which is huge?
Well, I guess one thing that I'd go back to is I would do an inventory on what time do you actually spend with your child. Do you spend quality time with them where you're engaging about life? So is it a family dinner? Is it a walk the dog around the block? Something other than driving them to practice, or eating while the TV's on, or playing a video game in the same room while you're reading the paper. That's not quality interaction time, and you can't just, when big issues like this happen, if you don't have that trusting relationship with your kid, you can't just come in and say, oh, by the way, let's talk about suicide, when they don't even feel comfortable talking about their homework. So I think we've got to look at that baby steps of talking with your kids and being comfortable with them. Then the big topics come easier.
Right. What is your team observing about children, teens, and suicide in terms of what are you seeing?
Well, unfortunately, these numbers are true not just of our team, but they're true across the country. We are seeing more kids that are attempting self-harm. And probably one of the more concerning parts it is, even if you compare the data as little as 5 to 7 years ago, the kids that are attempting are 2 times as likely to need medical intervention to treat what they did. So for example, maybe 5 to 7 years ago, somebody took enough pills to maybe upset their stomach, but it wasn't going to harm their liver or harm other organ systems. But now they're doubling or tripling that dose.
More aggressive.
Yeah, and then so they require a greater intervention. So that's a trend, and we're seeing it in younger kids too, unfortunately.
If I'm a community member, an adult watching, like, what can I do to prevent? Pay attention? I mean, where do you even start when you hear something like that?
I guess don't bury your head in the sand and think that it doesn't happen in Omaha, Nebraska, and that it doesn't happen in your child's school or your child's parish, because it's surprising. You can't put a lineup of 10 kids and by looking at them or even hearing them say a few sentences and go, oh, that's the one right there. In fact, sometimes it's the one, and oftentimes it's the one you go, oh, no way.
They got it together.
Yeah, they got on top of it. So I think the other thing, a lot of organizations, medical and school-based, are starting to do screening programs for kids. Encourage your kids to take those seriously and answer them with truth, and support them taking them. And if, by all means, if a professional says to you as a parent, hey Sarah, I'm concerned about your child, hear them out. They may be not completely accurate, that's a chance, but hear them out and make sure you go to somebody then that can help you with that, because people don't go out of their way to like make up concerns about their kids. So you
Sure.
don't want to be that parent that, oh well, I'm not going to listen to that, and then your child ends up with a significant mental health concern later on.
We want to remind you, if you're tuning in, that you can put questions either in the comments section or you can send it to us via a private message, either way. And that also, this is general information. It's not meant for specific diagnosis or treatment. Another mom, actually, I think it might have been the same mom actually, who asked a question about the ability to diagnose mental health conditions in children. Fair question. She had heard mental health disorders can't really be diagnosed until age 25. She'd heard once the brain is fully developed. So as a pediatric psychologist who works with psychiatrists, psychologists, how do you respond to that question?
Well, the brain is always developing in positive
Thank
ways,
God, yes.
and also developing in other ways as we pass certain ages. So our brain is a fluid, active, developing organ. So that part I totally agree with. And there are certain diagnoses that are more accurately diagnosed as kids get closer to their later teen years. But there are diagnoses that can be very accurately made in preschool years. Granted, there's a lot of individual differences on when people do diagnose, but we do have a manual that has criteria, and it's very reliable and valid, and if used by appropriately trained people. And the people that I know that are in our business aren't in this to put as many diagnoses on a child that they can get. And most of us are very reluctant to go with the bigger, heavier diagnosis early on. We want to rule out, and we make sure that, is this just an adjustment? Is this something we can do differently? And we're not in it to count the number of kids we get to diagnose. And the positive thing with this, though, is, Sarah, as I mentioned earlier, the sooner we can appropriately diagnose these kids and pick the appropriate intervention for them, the better our outcomes are. It's especially true with our eating disorder population and with depression. Anxiety is really true with that, because anxiety breeds anxiety and breeds anxiety and then can turn into something else. And the sooner we can get in, we can limit it and give that child resilience skills and coping. Make sure the parents are responding in a way that's not encouraging it to develop or enabling it. So it's nothing to be afraid of. Earlier is not bad.
Right. No, I like how you framed that. You mentioned anxiety, and that is something, working at Children's, I definitely have heard about more and more, and I feel like culturally we're hearing more about kids being anxious earlier. So is that a real thing? How common is it? And what should people know about, what's normal anxious? Oh, I've got a test today, and then when should a parent be concerned?
So we've got to remember that anxiety actually at a small level is good.
Yes.
It actually helps us make better decisions, maybe be a little more cautious, maybe makes us be a little more motivated.
Right.
If we're nervous about the test, maybe we're actually going to study and prepare.
Yeah, that's a good point.
So that's a good thing. So we don't want to eliminate anxiety. It has a value.
Yes.
But when anxiety starts to impact significantly the major areas of our functioning, and when I think of those, if it starts to impact how a child feels about themselves, if it starts to impact their peer relationships, if it starts to impact their performance at school, if it starts to impact their engagement in the family, those are the major areas that we look for. And thinking about it compared to other kids, not that we should be walking around going, well, this kid's this way, but if you see your child as one of the outliers when it comes to being more anxious or fearful about something, then it's to start asking yourself some of those questions. Is this more than I think? Or if it's a second or third child, maybe thinking, what was it like for those, and talking to teachers and say, hey, how does Sarah do in class? Is she comfortable getting up in front of the group? And but yeah, there are those areas. Interesting, in Nebraska, one of the things we see more of, and I didn't see this 20 years ago because there wasn't the Weather Channel.
Oh yeah.
But we've seen a huge increase in fears of storms. And so we've started experimenting a little bit, but using virtual reality therapy for exposure strategies for anxiety. So we're taking something that kids love, video games, and systematically exposing them to a more and more challenging expression of it. All the while we're pairing that with coping strategies and relaxation strategies, it's not the same as being there, but it's amazing if you've ever gone through a virtual reality. Your mind kind of really makes you feel like you're there.
Yeah.
And so it is really cool stuff. And the kids are like, oh yeah, I'll do that. And they don't really sometimes even realize they're doing therapy.
Sure.
And
It's
they
fun.
generalize it. Hey mom, I got to do this today, and they start talking about they positively experienced a windstorm. Yeah, you know, we've had kids that have gone through that, and parents have called back and said, wow, you've changed our child's life. We don't have to worry about them. They don't hesitate to get on the bus when the clouds are coming now. Thank you. This is awesome.
It's amazing.
So, make a big
It's that
difference.
high tech meets human experience.
Yeah.
Pretty good example of that.
It's great.
So I do wonder, and I think this might be a common thing, like, why more anxiety now? Is it just the world we live in? Are we just more aware of it and naming it and identifying it?
Okay.
What do you think? Why?
Well,
And right, for adults too. I feel like everyone across the board, children and adults, there's just more anxiety.
Well, one of my theories is that
That's a feeling, not a fact. But
yes,
you tell me if
yes.
it's a fact.
Well, no, I think we're seeing more of it, and I think people are being more forthcoming with identifying it. One of my theories, if we will, is that we are not promoting resilience development in our youth the way maybe that we did generations ago. We're protecting our kids from disappointment. We're protecting them from stubbing their toe, so to speak. And we need to, not that we need to force our kids into failure, that's not what I'm saying, but kids need to experience some rough spots. You know? We need to make sure that we're not insulating them from ever experiencing disappointment, frustration, and that they don't have to be perfect, and that they don't set up this world where they're expected to get everything right on every test.
Right.
So letting them challenge themselves is key.
Do you have other practical ways to do that? How to build up resilience in your child?
I think there's tons of ways. I think
And building them up in general, right?
Yeah.
Just like making
So,
them strong.
I think one of the things that we need to continue to be good at is when we give reinforcement is to make sure it's immediate and specific and pure. Don't say, wow, you did great at that, it's about time. You know, that sort of stuff. To say, you did really good, your balance was really good, you were really confident the way you stepped up to that. So use words that are consistent with resilience. Strong, good decision, brave, those sorts of words are big. But you can teach resilience by teaching kids to do everyday things on their own. I like to fish. So if a young person comes out on my boat with their mom or dad, by the time they leave that boat, they're going to be baiting their hook.
Right.
They're going to be, now would it be quicker and easier for me to do it for them?
Yeah.
But some of them, even though they're 5 years old, get to the point or younger, they're taking the fish off the hook by the time they leave the boat. You think, well, wait, how does that teach resilience? Well, they had never done that before. And then they get on the boat, and 2 hours later, they're doing it. And they're motivated because they love fishing and they love being on the boat. So we need to be creative in those ways and give our kids chances to not just do it the easy way, for it's easier for us to do it. And
It can be tempting sometimes.
I'm sure it can, but yeah, that and then
in the long term.
Yeah, and giving them feedback too. I mean, it's not if a kid doesn't do well at something, not like you say, wow, you really didn't do well at that, but just say, okay, that didn't go as well as you'd liked it, correct? Yeah, no, it didn't. Well, let's look at what you could do differently. Let's also look at what you did really well, and let's figure out a way to try something else.
Sure. So very aware that we are talking, broadcasting via social media. So we know there's positive pieces of social media, but we all know there's negative aspects of it too. I'm curious, what impact, as you listen to patients and you are listening in our community, what impact are social media pressures having on mental health and children and teens?
Wow. We could have done a whole segment on
I
this.
know,
Sarah.
right? We could go hours. We will not.
No,
but
we
there's
won't.
just so much to talk about.
So I'd say let's keep it somewhat general in the sense that, social media has had an impact on our children's functioning, their self-image, their mental health, their adjustment. And cyberbullying is real, and it can happen in a flash compared to bullying when I was growing up, or rumors starting. It's rampant. And social media can, if not used appropriately, put children in position where they're making adult decisions with a child brain. And
That makes sense.
that's dangerous. It's not the social media that's the problem, it's how we use it, or how we don't prepare our kids to use it appropriately. It's very dangerous. You wouldn't give your 5-year-old the keys to the car and say, here, everybody, this is just, everybody's got one of these, so just use it. No, you would teach, you would go through it very slowly, and if they misused it, you'd take the use of the car away, and you'd wait till they were getting their license or their pre-license or whatever at that point. So, I think parents need to take the time to be aware of what sites their kids are on. They need to know, they need to be as savvy as their kids are to get access to these, and maybe not rely on the blockers, because a lot of times kids can be, if they don't know, their friend knows how to get them around that blocker.
They have their ways.
And I would be old-fashioned probably if I instituted this with a teen at home, but I think I'm a firm believer when my families ask me is, I think there should be docking stations at night for phones that are not in the teen's room.
Yeah.
There's no need, unless there is a parent that's traveling or there's a situation like that that needs for them to have a phone, because it disrupts sleep. And a lot of things that are happening there when it's under no supervision might not be those things that you would want your teen being involved in. So
Right.
Being educated about, talking about things, if things present in social media, talking to your kids about it. And if you hear about things that occurred, sitting down and having a conversation with them. We look back to the film series that came out with 13 Reasons.
Yes.
And I think that, we want to say, wow, that caused some issues, but it also gave parents an opportunity to talk to their kids about a very difficult issue. And I encourage parents, if they were going to have their child watch it, or their child was going to watch it somewhere else, sit down and watch it with them. Talk about it. Talk about how you could talk to me if you started to feel that way. We can't ignore social media because it's everywhere, but I think we need to be careful not to throw it under the bus either.
Right. There's some good practical tips in there. Teenagers might not like the docking station idea at night, but good luck.
So start it early and get used to it.
There you go. Exactly. Not too controversial.
Yeah.
So, anything else that you would like to tell parents if they feel like maybe their child could use some help, or maybe things are feeling like it's hindering things in their lives? Anything? How do you reach out? How do you get the help you need?
Well, I think you have to find somebody in the community that you trust first, and whether that is your primary care physician, a teacher, a school psychologist, if you have a friend or a family member who has shared with you that their child or they know somebody that has this, but then go into it with just a more of an awareness mindset of looking at this person's history and their organization and what are their missions and those components, because there really are you're not going to harm your child by having a quality professional just take a look. And then it can be so reassuring to say, hey, this is a real typical reaction to what's going on, and you're doing a great job as a parent. I think that's a wonderful message, and then and rather than to sit there and doubt and go back and forth. So I think that's big. And just finding that trusted individual and wherever that is in the organization that you can find, that's a key piece.
Thank you for your expertise and sharing it with us today, and your time and your caring. You mentioned mission, and children's mission is to improve the life of every child, and we would be amiss if that did not include mental and behavioral health, because we know the impact it can have on children and teens in our community. So thank you for joining us. And if you want to learn more about children's behavioral health, Dr. Vance is a part of that team. You can find more information on children'somaha.org.